Hello, Tony Marlette Jr. here at Brookside Tax and Financial Group. We want to go over the basics of the Medicare Open Enrollment period coming up. Runs October 15th through December 7th of this year and every year. Really, my goal today is just to go over some of the terms affiliated with it, the different enrollment periods that you have, and what you can and cannot do during these periods as well. So let's just start by going over just some quick definitions. A lot of the pieces and parts of Medicare are defined by letters, and a lot of the plans are too. It does get confusing. So Part A, very simply, is your hospital insurance. Most people do not pay a premium for Part A, and you're automatically enrolled if you're receiving Social Security benefits. If you're eligible for Part A, or if you're turning 65 and you're not on Social Security, you have to go manually enroll, but there's still, for most people, is no premium, no monthly cost for it. Part B is your medical coverage. You are not going to be automatically enrolled in Part B. You have to sign up for it. There will be a monthly premium. It's income based. For most people, it's in the $170 range. And then you also have a deductible of $233 with Part B. We'll go over some details on that as well. When we talk about Part A and Part B, that's what we refer to as original Medicare. And we do that because we also have a Part C and a Part D. As you can see, Part C is your Medicare Advantage plans, which offer supplemental coverage. And then your Part D is drug coverage. Medicare Part A and Part B does not offer any drug coverage in and of itself. So if we talked about Part A, Part B, let's take a look at some details as far as what is covered and then what is not covered on these as well. So if we look at Part A on your screen, as we mentioned, most people do not have a premium with Part A. And you're automatically enrolled if you're receiving Social Security benefits. You do have a $1,500 deductible for anything with Part A. So that just means you have to pay $1,500 before anything is covered by Medicare. You can see some of the other expenses there as well. So Part A of Medicare pays hospitalization. The items that are on the right that say you pay are your costs that are involved as well, assuming no supplemental coverage. And we'll get on that in just a second here. Part B, we mentioned, is hospitalization. There's separate costs and separate deductibles involved. So if we look at what we have with Medicare Part B, we can see that, again, the premium is around $170 per month. You do have a $233 deductible. After that, roughly, everything is about 80-20 as far as coverage goes. Medicare pays about 80%. You're going to be on the hook for 20. So when we look at the four basic parts, which we just discussed, what are the different enrollment times and what can you do? So the most common enrollment period into Medicare is just what we refer to as aging in. You're aging into Medicare. You're either 3 months before, 3 months after, or the month of your 65th birthday. Now, that in and of itself does not necessarily mean that you have to enroll into Medicare. If you're still working, you can remain on your employer coverage as long as it's creditable, which most employer coverage is, and you do not have to pay a penalty. You can take Part A, as we mentioned before, since you don't have to pay for it while you're still working, and not have to worry about paying a Part B penalty. If you're not working, you need to sign up for Medicare Part B 3 months either way of your 65th birthday or the month of. So you really have a 7-month enrollment period when you're aging into Medicare. The annual election period, or the open enrollment period, which is, as we mentioned, October 15th through December 7th of every year, allows you to do a few different things. So you can sign up for Part B if you missed it. You will still pay a penalty. Same thing goes for Part D, your drug coverage. If you don't have creditable drug coverage, you can sign up during annual enrollment. You'll still pay a penalty, but you're able to enroll at that point. Penalties can range, they're based on the national average, and they do not go away. So they do last you for life. So you want to make sure that you get in when you're eligible. Everybody has a special enrollment period, or most people do anyway. This is probably the most common when we see people that are retiring or leaving their employer and they're not going to have their coverage anymore. This can go for spousal coverage as well. So if you're covered by your spouse's plan or you're covered by your own work plan and you're going to be leaving, you have a special enrollment period where you have 8 months to enroll into Medicare if you're going to be going on Medicare. Now, it doesn't matter if you say retire in January of 2023, 8 months go by and it's September of 23, and you try to enroll in November, you're going to pay a penalty. So you want to make sure you get in within that 8-month period. And it does not matter if you have COBRA coverage. What matters is when you last had your creditable coverage. There's also another enrollment period, which is more geared towards Medicare Advantage plans, which goes January 1st to March 31st of every year. And that just allows you to enroll or disenroll and make changes in your Medicare Advantage plans. So you might be asking yourself, what can we do to help you make a decision on this? Well, part of what we do is review your coverage with you. And then also we can offer supplemental plans as well. I think really if we look at the mistakes that we see people make, if you look at the examples on the screen, number 1 and number 4 are probably the most common. So number 1, we talked about before, postponing Social Security. You still want to get on manually on Medicare Part A, and then you want to make sure that when you have your Part B open enrollment, whether it's your aging into Medicare or your special enrollment period, that you take advantage of that at that time. And then if you are purchasing a Medicare Advantage plan, make sure that your healthcare provider is listed in there. It also is worth noting that none of this enrollment period, any of the enrollment periods, have anything to do with Medigap coverage. So Medigap coverage is designed to bridge some of the gaps that Medicare does not pay, similar to a Medicare Advantage plan, except they do not use networks. So your Medicare Advantage plans are going to use HMOs, PPOs. Your Medigap or Medicare Supplement is going to be covered by any doctor that accepts Medicare, and that's across the country. Medicare Advantage plans are often regional. So to go through any of this, if you'd like us to help you out, you can schedule an appointment on our website or give us a call. We can go through the different alternatives and tailor a plan for you. So from all of us at Brookside, we thank you for working with us, and we look forward to continuing to work with you in the future.